Hey guys, welcome to Tuesday Talks with the Green Bay Doulas. I'm Emily Jacobson. I'm here today with the amazing Dr. Lyerly.
Hey!
And we want to talk about something that I thought I needed to have somebody who really knows this side of things. But you're with your doctor or midwife, you've established care with them, you've seen them your whole entire pregnancy, and now you're in labor and you show up at the hospital and they're not on call.
What are you going to do?
What are you going to do? So what are some things that somebody can do when they kind of realize their doctor or midwife is not going to be the one to deliver them?
It's a really hard situation, and we have the same concern because we do like to deliver our own patients. But the truth is, we can't always be there.
Yeah.
We have our own families, and we need
rest.
and, we need time away as well. So that is the relationship between doctor and patient is incredibly important to our patients, and it's incredibly important to us too. But we can't always be there. And sometimes we're there for other patients as well. And that's a real chance to establish a new relationship and focus on some of the things that maybe you haven't had a chance to build over a period of months, but now you can do it.
Mm-hmm.
So how do you do it?
Yeah.
Well, I think it starts with your introduction and making sure that you know what the maybe top 3 most important things are to you. You've spent months talking about your hopes and dreams and what is important. So every little detail is not going to be able to be addressed with this new provider and may not be able to be addressed with your old provider either, because you just don't know what's going to happen in labor. But if there are some things that are really important to you, you want to make sure that your doctor knows that. What do you say?
Yeah, you're not going to call out the gender of the baby. The husband is, because you're not finding out.
Right. Or maybe you don't want anybody to talk to you about pain medication because it's your desire to just go through without any additional pain medication, and you don't want to be tempted. That's absolutely fine. Make those top 3 things known to your physician.
Yeah, and I think even just giving them just a quick hello and who you are, but sometimes you don't even get that. Sometimes it's, we're calling for delivery, and here comes a person, I feel like that can be very disconnecting. What advice would you have for somebody when you don't even get a chance to even meet that person? All of a sudden, here comes your baby, and the switch just happened at 7 a.m., and now in comes this new doctor.
And I don't even know who you are, and you're going to deliver my baby?
Right. Like, how can people work through that while in labor, but also maybe later processing it? Is there anything that people can do?
Yeah, absolutely. Yeah, and I think this isn't just in that kind of a situation, but regardless of what your situation is, if you don't know your doctor, you need to be empowered to be able to ask questions and make sure that you understand what your doctor is doing, how your labor is progressing, talking with your nurse and making sure that you're all on the same page. Nobody benefits from you feeling like there is a deficit in knowledge as you're in labor and postpartum at any point in time. Heck, even during your prenatal care or for the rest of your life, you should always feel empowered when you're dealing with your healthcare provider. And if you don't understand, it's so important to ask that question. It's hard to ask that question because you feel like, I don't want to waste her time, or maybe it's a stupid question. But really,
there's no stupid question.
There's no stupid question. This is your health, and you need to know. And if you don't feel comfortable asking your doctor, your nurse practitioner, whoever it is that's taking care of you, if you're not comfortable asking them, maybe they're not the right person for you. And if you're not getting the right answer, maybe you need a second opinion.
Which can be really hard to do because many people have a loyalty of like, well, my sister delivered with this doctor for the last 2, and so I'm delivering, or my best friend said they're the best, but they might not be the right one for you.
Right.
And you just have to find what's best. And I think really that communication, we tell our clients to use the acronym BRAIN. So benefits, risks, alternatives, intuition, and no or next. And again, no doesn't mean I'm not doing it. No just means like right now. What if we reevaluate it in a couple hours? And so really being able to ask those questions, or empowering whoever your support person is, whether it be your husband, your partner, your mom, your sister, your friend,
your doula,
to help as well with that, I think is really important too. And knowing that, I think that everyone there's the level of scared, and then the fight or flight kicks in, and then labor might even stall a little bit. But to know that like that's what's happening, and to not be like, just give it some time, I just don't know who you are. I always say, like, rabbits will stop their labor and run till they're safe and they feel calm, and then they'll start up again.
Wow.
We have the ability to do that as adults too. We always say, like, going from home to the hospital, it's exciting, but it's scary, and so sometimes you were in a very interesting pattern at home, and now we're at the hospital, and you're like, am I in labor? Oh, wait, yeah, I am. Because once you get comfortable, everything starts flowing again. So just being able to trust yourself, but really ask those questions, meet those doctors and midwives, and know that it is a reality that that person may not be able to be the one to deliver you.
And that's okay, because there are a lot of really good doctors out there and nurse midwives. The important thing is that you can communicate well with them and that they are addressing your needs and taking great care of you.
Perfect. Well, I will leave it at that. I can't close anything better than that. Thank you guys so much. We'll see you next week.
See ya!